Okay, why don't we get started, please? All right, good afternoon, everyone. Welcome. My name is Stephen Ganji. I'm the Senior Associate Dean for Academic Affairs here at the Bloomberg School of Public Health, and delighted to welcome you to what really promises to be an interesting discussion about women, girls, and alcohol. First, I'd like to acknowledge the Center on Alcohol, Marketing, and Youth that's hosting this event and webcasting this event, and acknowledge their recognition of the Center for their first 5 years here at the Bloomberg School of Public Health. In those 5 years, and for even years beforehand, the Center's mission has been to monitor the marketing practices of the alcohol industry and focus attention and action on industry practices that jeopardize the health and safety of Americans' youth. So the center is led by Dr. David Jernigan, who you'll hear from in a moment. The center has really taught us all a great deal about the public health risks of alcohol marketing and advertising that they pose to young people in the US and abroad. And there's really no more relevant time to be focused on these issues than the present. Just to give you, as a statistician, can't help but give a few statistics. 23,000 women and girls die each year in the United States from drinking too much, and 14 million women in the United States binge drink 3 times a month, consuming an average of 6 drinks per binge. In the last 3 years, binge drinking among young males aged 12 to 20 has fallen by 17%, but there's been no change in young women's binge drinking prevalence. Excessive drinking in women is associated with increased risk of breast cancer, heart disease, unintended pregnancy, and sexually transmitted diseases. So this, I think, these statistics are quite important, and I think Dr. Jurgensen's research, which focuses primarily on documenting how alcohol advertising and marketing are reaching young people in the United States is very timely and very important. Obviously, very much of a public health concern because we know that these issues have a significant impact on youth decisions to drink. So David has also worked as an advisor to the World Health Organization and the World Bank on alcohol issues and co-authored WHO's recent Global Status Report on Alcohol and Health. He's the author of numerous publications and trained thousands of public health advocates in media advocacy and alcohol problems prevention. So let me turn things over to David.
Thank you very much, and thank you all for coming. It's my job to just tell you a little bit about the center and then set up our main event, which is Ann Doubts at Johnston. But just a couple of things about the Center. Center on Alcohol Marketing and Youth, also known as CAMY. We were founded in 2002 at Georgetown with funding from the Pew Charitable Trust and the Robert Wood Johnson Foundation. We came to the Bloomberg School with a little bit of that money in 2008, went dark for a year, and then picked up CDC funding in 2009. So we're commemorating our 5 years here. Dean Ganji talked about our mission. And it is fundamentally that there's a tremendous amount of good work that happens around reducing young people's access to alcohol. There's much less happening about reducing the appeal of alcohol to young people. So that has been our niche. Our approach is to use research to inform policy, to issue nonpartisan research reports, to provide a factual basis for the policy conversation, initially over alcohol advertising, and then to complement this with tools for communities and policymakers about how we can implement evidence-based strategies to reduce both youth access to alcohol and the appeal of alcohol to youth. Some highlights over the last 5 years: more than 30 peer-reviewed articles published, 9 more under review, 9 commentaries and solicited editorials in peer-reviewed journals, 3 book chapters, 1 action guide, and 2 more in print. That's what the picture is up there. 6 reports on youth exposure to alcohol advertising and related legal issues. The brochure on alcohol marketing and digital media, which is at the table outside. And then we've reached thousands of people through more than 100 conference presentations, trainings, and policymaker briefings. I'm tired. And then, of course, we do a tremendous amount with the news media. As Vinnie DeMarco said, this is like a giant telephone that enables us to reach millions of people. So we've generated or contributed to more than 1,000 news stories over the past 5 years in most of the leading outlets in the US. And in new media, we have close to 700 followers on Facebook and Twitter. And then we produced 3 YouTube videos on alcohol marketing and digital and social media. We've done podcasts, and we have a new infographic that will be out shortly. CDC interprets marketing quite broadly. We originally started our center looking just at the advertising, but for CDC, marketing is about the 4 Ps. Product, and so we've done the first, in collaboration with Boston University School of Public Health, the first ever survey of young people's alcohol consumption by brand. Price, we house a center, a collaborative center with 3 other universities doing research on the effects of alcohol taxes on public health. On the place side, we work a tremendous amount on reducing alcohol outlet density, including here in Baltimore. But most of our work is on promotion. In the promotion area, what we know about alcohol marketing in young people, and more studies come out every year, but there are at least now 15 longitudinal studies that have looked at young people's exposure to alcohol marketing in various media and looked at their drinking behavior at baseline and then followed them over time. What all those studies have found is that the more young people are exposed to alcohol advertising and marketing, the more likely they are to start drinking, or if already drinking, to drink more. One of the studies has now followed the young people long enough so we can see that the line goes right through to negative consequences. The greater media exposure at baseline then leads to greater likelihood of consumption and greater likelihood of negative consequences. Alcohol, #1 drug problem among young people. As Dean Ganji said, he already said some of these statistics. Binge drinking is the risk behavior. And 1 in 8 adult women, 1 in 5 high school girls report binge drinking, including 27% of high school seniors. 52% of current female high school drinkers are binge drinkers, including 60% of the 12th graders. This is what we're concerned about. As you can see from these curves, the blue line is the boys, and we've made progress in reducing boys' participation in binge drinking in the last 30 days. We're not making anywhere near that progress with young women. Why do we care in particular about women? Women metabolize alcohol differently from males. So a male and a female of the same body weight can drink the same amount of alcohol and end up with higher peak alcohol levels. This is why we define a binge for males as 5 drinks within 2 hours, a binge for females as 4 drinks within 2 hours. It's not a fair competition for a woman to try to keep up with a man's drinking. And then there are particular health problems that females are at risk for. 15% of female breast cancer cases are attributable to alcohol. Other cancers, also interpersonal and sexual violence, both of these are much more likely when alcohol is in the picture. Depression. Adolescent girls are twice as likely to be depressed as adolescent boys, and the relationship between depression and substance abuse is stronger for girls than for boys. And then unintended pregnancy. It's not safe to drink at any time during pregnancy, and the risk of fetal alcohol spectrum disorders is highest in the second half of the first trimester, when many young women don't even know they're pregnant. So why do young women drink? And when I do this as a seminar, I have the group brainstorm. There are so many different reasons, etc. My fundamental reason is young women drink because they can. CDC's factors in young women's drinking include adult women's drinking. Social modeling is important here, and Anne will talk more about that when she speaks. The price and availability of alcohol are important. The religious and cultural factors. All over the world, religion is the single most protective factor for people's drinking. But exposure to alcohol marketing is also a key part of the mix. So Virginia Slims in a bottle. That's what I call this talk. And how did this happen? How did we get from Virginia Slims and tobacco to today, Bailey's Irish Cream advertising, targeting women, be a woman for a cause, not for applause? Well, the beginning was a product we call the Alco Pop. Smirnoff Ice, Mike's Hard Lemonade, Bacardi Silver. On colleges, these are known as chick beer. We like to call them beer with training wheels. They were most popular at their peak in every age group with females. They were also, among drinkers, most popular with the youngest drinkers. Fast forward to alcopop marketing today, a quote from Dr. Seuss, why fit in when you were born to stand out? But back to our main story. Marketing alcohol to women and girls involves having the right product promoted in the right way at the right time, at the right price, in the right place. And I'm going to focus on product and promotion here. I brought my little gallery of products here and a couple of ads, partly because if you're not a drinker and you're not drunk, I'm sorry, if you're not a drinker and you're not young, you are so much less likely to see this. This is part of the problem with parents trying to think about young women's drinking, young people's drinking generally. So much of the marketing flies under the parental radar. So the right product, things like pucker vodka, whipped cream vodka, skinny girl. It's so hard to imagine any guy walking into a bar and saying, can I have some of the kissed caramel vodka? Crew vodka packaged in a silver water bottle, and then the messaging, alluring with sophistication. This is tequila sold as a love potion. Now, advertising in the US is primarily governed by the alcohol industry's own self-regulation. I'm going to use you quickly as a focus group. The codes have all sorts of things about content, like that they should not contain any lewd or indecent images or language. How many of you know what your O face is? That is the face when you're reaching sexual climax. You decide, but that one in the middle, she is adjusting her lipstick on her knees using her boyfriend's belt buckle as a mirror. Now, how many of you think that that's a violation of this feature of the code? Let me just see a show of hands. Okay, let the record reflect for those of you on the web, most of the room. The right messages also, they're not allowed to advertise alcohol explicitly as a health product. So they advertise it as a low-calorie fitness product. It's distilled from soy. It has antioxidants. It advertises on the Weight Watchers website, and it is the beer for you to drink when you're going full speed, except, of course, when you're in a car. Some of the marketing and digital media is also generated by the users themselves. She's kind of my poster girl. She's doing it all, and I'll bet she's not wearing sunblock. The companies, these are on company Facebook pages. They're supposed to be responsible for taking down irresponsible images. We'll see. And there's a tremendous amount of this happening in digital and social media. This is just the number of user photos that are going up on 10 products that are most popular among young people. So content is very difficult to regulate in the US, and so our focus is not on the content, but on where the ads are being put. Can we get the ads put in fewer places where kids are more likely to see them than adults? If we're going to do that, we have to be able to answer the question, how much alcohol advertising are kids seeing compared to adults? So we track alcohol ads on TV, radio, magazines, and we're starting to try to figure out how to track it in digital and social media. We use industry standard sources. Our studies show that over and over again, kids are being exposed to more alcohol advertising per person than adults. Specifically, the industry has a code. It says that they will not put their ads in any place where kids are more than 30% of the viewing, reading, or listening audience. We just published, and I think that was also on the table outside, a new study in Mortality and Morbidity Weekly Report, where we looked at advertising for the 10 most popular programs among young people in 4 categories: broadcast cable, broadcast sports, broadcast sports, broadcast non-sports, cable sports, and cable non-sports programming. Across these 40 programs, we then looked at 25 of the 26 largest markets in the US. We couldn't get data for one of the markets. And we used local ratings data for the first time because markets different in the age demographics of each market. If you use the local ratings data, we found that nearly 1 out of 4 of the alcohol ads on those programs were in violation of the industry standard. In radio, we looked across 75 markets in 2009. 1 out of 11 ads violated the standard. And on television, youth exposure is actually getting worse. From 2001 to 2009, youth exposure to alcohol ads on TV grew faster than any other age group. In 2009, the average TV watching 12 to 20-year-old in the US saw 366 alcohol ads. That's one a day. That's great for vitamins, not so great for alcohol ads in kids. And of course, really difficult for parents to keep up with that level of sophisticated, well-produced conversations about how great it is to drink, with the parental conversation that our government encourages us all to have with our kids about the downsides of drinking. I should say almost a third of the radio ads were on programming that kids were more likely to be listening to than adults. TV girls, again, we're starting to do some of these gender studies. We did one years ago in magazines and found that in 2002, kind of at the height of Alco Pops advertising, girls were seeing 95% more advertising for Alco Pops in magazine than women of the legal drinking age. This is TV. This is just a few of the products that are overexposing underage girls, that is hitting the underage group more than they hit the legal age audience. We have a new analysis that I don't have in here yet, but it's very exciting in all of this work that we finally have brand data. We have brand data for tobacco. This is part of why we knew that Joe Camel was such a big deal and the Camel advertising needed to go. We haven't had that for alcohol. When we start looking at advertising by brand and we start looking at the girls, we find that for the 25 brands most popular among girls in the US, those brands are 5.5 times more likely than the 300 other brands that are advertising to hit underage age groups more heavily with their advertising than of age groups. These ads are missing the target. That's what we think could get fixed. Again, if you look at male consumption, underage consumption, and you look at female underage consumption, you can also see that the girls are drinking differently than the boys at this point. For decades, young people in the US have primarily drunk beer. It's the cheapest, it's the easiest to get, and for decades it was all that was advertised on television. Well, now spirits ads are on TV, and we see a shift starting from the period of the Alco Pops, the training drinks, of a movement of the girls to the Alco Pops and the distilled spirits, particularly the vodkas, the flavored vodkas, etc. So those are the things that are highlighted in red, much more likely for the girls to be drinking those than the boys. So what can we do? Well, there is very little regulatory effort being expended towards alcohol. There's very loose approval of new products, and there's no apparent enforcement of provisions about content. In fact, the Beer Institute's Code Review Board has never found a beer ad in violation of their voluntary code. Wow. So the protections, we'd like to see tighter voluntary codes so that the youth are not so disproportionately exposed. We'd like to see them creating no-buy lists for programming that year after year after year is reaching more kids than adults per person. We'd like to see in digital media improved age verification. We just did an internet survey. Over a third of the kids have lied about their age on the internet. About 30% have created fake profiles, and so on. And yet the only protection is self-reported check off, yes, I am over 21. It's ridiculous. And then create no-buy lists in the internet and social media for sites that skew young. There are also things that can be done at the state and local level, and these are things we're really excited about. Baltimore was a leader in the country. We have the landmark billboard ordinance. We don't have alcohol and tobacco billboards in residential neighborhoods in the city. That case went all the way to the US Supreme Court. But there's more that could be done in terms of retail signage, in terms of advertising and sponsorship on things that our center is working on. Because at the end of the day, what we find is the alcohol they read, the music they listen to, the movies they watch, and of course, all over digital and social media. It is our conviction that we can do a better job of protecting kids from this kind of advertising, that the industry can do a better job, and that our children deserve better. Thank you.
Great. Thank you very much, David. That was terrific. Okay. So, as David mentioned, it's now my pleasure to introduce Ann Dowsett Johnston. An award-winning writer and editor, Ann is respected for her expertise in journalism, higher education, and alcohol policy issues. She is the author of Drink, The Intimate Relationship Between Women and Alcohol, published earlier this year by HarperCollins. The book was named one of the top 10 in 2013 by the Washington Post, had a lovely review November 1st of this year. The book combines in-depth research with Johnston's own personal story of recovery to deliver a groundbreaking examination of the global epidemic of women's drinking. It's certainly on my Christmas list as the father of 2 teenage girls. 8 years ago, Ann was a high-profile senior journalist with Canada's major news weekly, an award-winning journalist and popular on the speaking circuit. Struggling with alcohol addiction, she took a private exit from her personal life, took some time in rehabilitation, then re-entered personal life in 2010, winning the prestigious Atkinson Fellowship in Public Policy, which she devoted to closing the gender gap in the world of risky drinking. Sober now for 5 years, her personal and investigative journey gives us an unprecedented look into women and drinking that is both moving and enlightening. So it's very much my pleasure to welcome Ann Dowsett Johnston to the Bloomberg School. Thank you for coming.
Thank you for that very kind introduction. Lots of my story in there, and you'll be hearing more of it. I want to say what a great pleasure it is to be here today. To celebrate CAMY's great success, I have to tell you that celebrating the leadership of David Jernigan is something that is really dear to my heart. I have learned so much at David's feet. He has been an expert professor for me, and when I was doing the fellowship that was just referred to, the Fellowship on Women in Alcohol, which was a one-year project, I started my whole education here at Johns Hopkins with David, so it's really privately very important to me. Thank you so much, David. And thank you for this kind invitation. What a remarkable thing it is to be here today. As you know, I'm a writer, and I'm going to open with a little story they tell about writers in Canada. I am Canadian, and they tell a story about a writer who goes up to the pearly gates on a particularly busy day. And she's standing in line for about 3 hours, and she gets really irritated at the delay. She's not sure if she's going to go to heaven or hell. And so she goes up to the front and asks to see God. And when God comes out, she says, "You know, God, I have a funny feeling I'm going to hell. Do you think I could take a sneak peek at it?" And God says, "Yeah, no problem. First door on the right." And she goes into that first room, and she is just horrified because it's her worst nightmare. There is a whole room of people who have missed their deadlines, writers chained to their desks, tapping away on their computers, sweat pouring from their brows, hair disheveled, clock going round and round like this, clearly not producing on time. She closes the door and she goes back to God and she says, "God, do I have time to see heaven?" And God says, "Sure, first door on the left." She goes and takes a peek, and lo and behold, it's the same damn thing. A whole room full of people chained to their desks. Clearly, they've missed their deadlines, looking terrible, clock going round and round, tap, tap, tap. She goes back to God and she says, "I don't know, God. Heaven and hell look just the same to me. What gives?" And God says, "Oh, no, my dear. In heaven, the writers get published." So that was the good news for me. This fall, I'm just going to make sure that I don't make David late. That was the good news for me, and it was heavenly. My book, Drink, was published. This is the way it looked in Australia, with a woman falling down a bottle. and this is the way it looks here. And this was heavenly for me to see my first book in bookstores. That was the good news. The bad news was I outed myself as a person who had a risky drinking problem, to put it mildly, to the entire world. This appeared on 3 continents. And that was the bad news. Not only did I out myself as a person with a drinking problem, but I outed myself as the poster girl for the modern alcoholic. And she looks like this. She's female, not male. She's high functioning, not low functioning. She is educated, as I am, and she is what we call high bottom. And high bottom means that she had not lost everything. Now, I've done tons of interviews all over the world in the past 2 months. And over time, it came to me that there was one question, no matter what the country, that everyone asked me. And it was this: why did you write this book? And I came to see this as one of the rudest questions I could be asked, because what people were really saying was, number 1, are you crazy? Number 2, how much did you drink? And number 3, do you ever think you'll work again? And the answers to those questions are this: no, I'm not crazy. I really believe that our secrets keep us sick. Number 2, will I ever work again? Well, I'm not sure if I will ever be hired again. I think when you come out with a book called Drink, I think there's some questions, and I think the stigma obviously is very, very high around alcoholism. And how much did I drink? I drank too much, and a lot less than you're thinking I drank. A lot less. I was, as I said, a very high bottom drinker. And the reason I wanted to write this book, and probably have wanted to write it since I was a little girl, is that I'm a daughter of a poster girl for another era. My mother was a very, very beautiful woman. That's the poster girl now. This is the poster girl then. Very, very beautiful woman. This is me on the left wearing glasses. My mother in the sweater and my sister in between, who was a writer herself, who fell into a terrible depression, was prescribed Valium, which was so common in the 60s, and began to drink herself and was not a high bottom drinker, hit a very low bottom after 30 years of alcohol, and really destroyed her life. And if there was one thing I was determined I was never going to be when I grew up, was an alcoholic. She led a very, very troubled life, and my whole life was marred by her drinking. And therefore, I led a life of denial for, I would say, about 3 years. A life of denial because I didn't, as she did, stay in bed. I didn't miss whole days. I didn't end up in jail. I didn't crash a car. And I raise all those things because I think they're important to talk about. And that is that risky drinking can look anything but what we think of it. We tend to, in our culture, other the person with an alcohol problem. We tend to say it's the rare alcoholic, it's the rare person who lives under the bridge swinging from a brown paper bag. We live in a highly, highly alcoholic culture, a culture where we tend to say that if a person is sophisticated, they know their wines. If they're hip, they know their vodkas. If they're young and female, they know their coolers. If we walk into most social environments, first question you'll be asked is red or white. We know all about the dangers of trans fats. We know all about the dangers of tanning beds, but we know very little about the dangers of our favorite drug, and it is our favorite drug. So let me just catch up with my notes here for a minute. I've spoken ahead of myself. So I fooled myself, as most of our culture can fool ourselves, and I will say that when we drink too much, we often say we're just drinking like the French or the Italians and imbibing in the name of sophistication. I drank in a very, very private way. I drank in such a private way that my best friend would swear to this day that she didn't think that I had an alcohol problem. But my wake-up call came in the form of a Mother's Day card, and the Mother's Day card looked like this. It was a Mother's Day card that I opened 7 years ago, and I opened to great joy. I saw a heart behind my head, and I saw Happy Mother as a portrait. And what I didn't see was the background, or was the fine print. And the fine print said, "From my son, note lack of bags under eyes." And it said over on the left, "Perrier, not wine." Now, behind this Mother's Day card is a story. I had had a root canal, and I had been asked not to have a drink for 3 weeks while I was on antibiotics. And my son, who was away at college, happened to be home during this period, and he noticed a few things. Obviously, he noticed that there were no bags under my eyes. Obviously, he noticed that I was drinking Perrier. He also noticed that my mood was good. He noticed that I was sleeping well. This is the card that I would like to say sent me off to rehab, but it didn't. And the reason it didn't was I hadn't progressed to be an alcoholic at that point. I was just risky drinking. And I raise that because I think we tend to, as I said, other the alcoholic, and we forget a whole common form of drinking, which, as David told us, was binge drinking. Very, very common habit. In fact, the most common habit for those who are in trouble with alcohol in our culture. It's the risky drinking of a large proportion of us, and in Canada that is 80% of those 15 and older, that actually causes the largest damage in our society. So let me just catch up here. Alcohol abuse is rising in the Western world. It's rising in the Western world, and my slides are going to look a little bit different than David's. Rising in the Western world, and this isn't actually where women are, but in fact the curve upwards of women and the flatlining or even downturning of men. Why do we care? We care because women have traditionally had a lot less to drink in our culture than men have. We care because women are on the upswing, on the up curve, and this is true globally, and it's true that the richer the country, the smaller the gap between men and women. This upward curve on the part of women is severe in some countries, and I'll cite the UK, where liver disease has grown 20% in the past decade. And young women in their 20s are presenting with end-stage liver disease at an alarming rate, a really alarming rate. And I'll get back to pricing in a minute, but it's no coincidence that in that country, 4 supermarkets really are in charge of liquor sales in many ways, and liquor is often cheaper than milk or orange juice. So this is the truth. The richer the country, the smaller the gap between male and female consumption. And what has not been properly appreciated is that while women have begun to go toe-to-toe in the workplace and outpace women in terms of post-secondary participation, we're leaning in, and we're leaning in a lot more to the bar than anyone ever expected. Now, the alcohol industry is all too aware of this reality and is battling for our brand loyalty. And witness the surge in the products that not only David showed you, but other products, products that are aimed at women my age, products with names like Mummy Juice and Mummy's Time Out. Yes, Happy Bitch, I regret to tell you. Cupcake wine, French rabbit wine, these are not manly products. And when I wanted to figure out, when I started doing my fellowship, I wanted to ask, when did the market get so squishy and pink and sweet? It was David I came to, and it was David who explained to me how the distilled spirits industry had looked around the world on market segmentation and being very jealous of beer's success, beer being fun, beer being sports, beer being entertainment, said, how are we going to play catch up? And saw a whole gender that was underperforming. this spirits industry has done a remarkable job. And when I hit campuses, and I have been to a lot of campuses recently, you'll find young men and women talking about playing drinking games, but you'll find that he's drinking beer, she's drinking shots, she's drinking vodka or tequila. She's 2/3 his size. And she is probably not eaten because she's on a date or on an evening out. He will have eaten. She's at a total disadvantage. And as we all know, alcohol is the #1 date rape drug and has been for years. At my alma mater, which is Queen's University in Canada, there is a habit on the first week of orientation, which is to take a magic marker and write your address on your forearm so that when you pass out, and there is competitive passing out games, when you pass out, somebody knows where to deposit you at the end of the evening. This is pretty regrettable. So while in Canada we've made a really wonderful inroad in terms of reducing the stigma around mental health, and this same group of students that I met at my alma mater was more than aware of what to do if one of their colleagues, one of their friends, one of their roommates suffered from depression. When I asked them, how would you know if one of your roommates was suffering from some form of alcohol abuse or was abusing alcohol, they all shook their heads. They knew what to do if a person was intoxicated, to roll them on their side so they didn't throw up and die, but they didn't know anything else. And one of them said to me, I have a roommate who's drinking a beer in the shower every morning. Do you think they have a problem? And I said, yeah, I think they have a problem. And the problem is this, is that university, of course, is not the initiation of drinking, it's the escalation of drinking. But at a certain point in their 20s, traditionally, women slowed down. Young men and women would marry after university, and he might still be drinking into his 20s, but she would typically slow down. That's not happening any longer. In fact, the steepest increase when we look at Canadian data for the uptick in drinking, if you look at this kind of measurement, is happening in women between the ages of 24 and 36. And what's really alarming about that is this is the age group that is giving birth to roughly 60% of Canadian babies. So that's a really, really upsetting truth and produces a very disturbing picture when you look at rates of fetal alcohol spectrum disorder. So why should we be so concerned? I mean, there's obvious reasons why we should be concerned, and both speakers ahead of me have flicked at the notion that democratically we're equal, but metabolically and hormonally we are not. And what's most disturbing to me is that we're not having a conversation about this reality. Women aren't slowing down, I would say, in their 20s and 30s, but I should also share that they're not slowing down. They're drinking differently in their 40s and 50s, but in terms of, I'll give you an example, a person in their 40s and 50s is more likely to drink daily and maybe less, but is drinking on a daily basis, whereas this comes from Catherine Keyes at Columbia, who looked at 31 studies, international studies, and those born around 78 and a little after that are more the weekend warrior who will drink to pass out on the weekend and not necessarily drink daily. But whether you're drinking daily or you're drinking over your limit just on the weekends, the reality is that it's very dangerous for women to drink over their limit for all sorts of reasons. Both men and women get into trouble, and they die typically 20 years earlier from an alcohol-related death than a smoking death. But many of the consequences happen earlier with less consumption for women. I will say heavy drinkers of both sexes, for instance, run the risk of a fatal hemorrhagic stroke, but the odds are 5 times higher for women. Women become addicted much faster than men, much faster than men with less alcohol, and that's called telescoping. So there are many reasons, and I think the simplest figure to remember is 15% of breast cancer cases are related to alcohol. So there's many reasons for women to start having a dialogue about what safe drinking looks like. Safe drinking is roughly 10 drinks or less a week. I think one of the questions, obviously, is why aren't we having a conversation about this? We know the downsides, the gap between the science and the gap and the research of what we know and what we do not do is enormous. And the evidence is clearly there. But the evidence being there is not enough for us. Our values on this subject are very, very fuzzy. One of the most profound questions I had to wrestle with when I looked at this subject was the whys. Why is this happening? And I came up with, for women, with three really profound reasons. Number one, I think alcohol has become the modern woman's steroid, enabling her to do the heavy lifting in a really complex world. And I think most women would acknowledge it is a complex world. We have not really worked out all the ticks in a socioeconomic revolution in which we're still wrestling with things like childcare, etc. So a woman races home from a busy day at the office. She has to put dinner on the table. She has to oversee some homework. And it's not uncommon to pour a glass of wine while she's chopping vegetables. That was my story for years. And I would pour that one glass of wine. Many nights I wouldn't pour that glass of wine. I might pour a second glass of wine while I was having dinner. I would go back to work in the evening. I would oversee homework in the evening, and that would be it. And I was definitely within the safe range for years and years. What we don't acknowledge is that alcohol issues and problems are progressive. And in my case, they progressed. And they can progress and be problematic for many, many years before they bloom, as mine did, into something quite remarkable. And alcohol problems are marked by denial. So one can be in the midst of what is classically a 12-year trajectory in most women's life, going from so-called risky behavior to very risky behavior. One can be in the midst of that for a long time and have problems that you would recognize, problems with being late for work, not sleeping well, et cetera, et cetera. But that would be the number one reason that I would cite, that for better or worse, if you ask a woman's only audience if they recognize this, I go to my book club and I drink more than I expected. I go away on a girls' weekend, I drink more than expected, etc. This is common behavior. The number, so a decompression tool. The number two reason is that women drink to medicate, self-medicate depression. Women are 40% more likely to suffer from depression than men. Medicate anxiety, medicate whatever ails them. That was definitely my story. And as David said, women drink because they can, because they're told to, because we romance the glass. So what are we going to do? When I like to consider what we might do as a solution, I like to tell a story of a frog pond that has a number of frogs that are growing, developing growths that are unseemly, and a number of frogs that are developing sterility. And most people look at this pond and said we should send in the fertility doctors and we should send in the surgeons to get rid of those warts. And one wise woman says, no, I think we should ask if there's something in the water. And my answer is, I believe there's something in the water. There's no doubt that we are awash in alcohol marketing. We're awash in alcohol. We're awash in it all in our culture, and I don't think, having listened to David, you have any trouble believing that. I think we need to begin to have an open conversation on how we might raise the next generation of women to look at alcohol a little differently. We know for many years that if you want to change the drinking culture, you have to press on the same levers that we did with tobacco. Those levers are well understood: marketing, pricing, and accessibility. We need to, in other words, close the gap between what we know and what we do not do. Increasingly, we're aware that the price of alcohol is one of the most effective approaches for reducing consumption and alcohol-related harm. We know that a person who's exposed to marketing is more likely to drink, and they're more likely to drink at an early age and have problems later. We have to show people what's happening, that this isn't a coincidence, that it's about placement of a product. Now, what we're seeing isn't new, but what we have to accept, as David once told me, is we aren't living in a corporate playground. We're living in a democracy. Earlier generations knew how to take a stand, and we need to take a stand. But as I said earlier, our values are very, very fuzzy. At minimum, I would say to the alcohol industry, and David's words as well, do no harm. I'd ask them to refrain from digital marketing, and I wouldn't let it be voluntary. Alcohol is too cheap, too glamorous, and too widely available. We need to tackle treatment and mothering. We need to tackle brief interventions in our culture. We need to do some truth-telling. We need to tackle violence and abuse and talk about its relationship to alcohol. There's so many studies that connect the two. Instead of saying what happened to that girl who's having too much to drink, we need to say, instead of saying what's wrong with that girl, we need to say what happened to that girl. What's wrong with that woman, we need to say what happened to that woman. We need to open up a dialogue, making it more easy for women to open up and tell that they have an alcohol problem. We have to tackle the physical health problem. We need to use women gender-specific measurements, the 4+ drinks, not the 5+ drinks as we have traditionally. We have some truth-telling to do. But if we're going to change public policy, we need to be a lot more comfortable with the dialogue than we are. We have the strong evidence. We need to be clear on our values. And as I said, right now, our values are very, very fuzzy. Finally, I'd like to take a minute to talk about women in the developing world, those undergoing rapid social change and gender role change. Of course, excessive drinking has come to represent gender equality, and we need to turn it around. The highest risk in those countries is for higher education women in these lower resource women to be susceptible to alcohol marketing. We need to design targeted interventions and tie it to the empower of women. If women can develop a means of enjoying alcohol in a healthier, low-risk manner, then we've succeeded. It'd be a powerful way to empower women in developing countries. Earlier this year in Canada, I launched the National Roundtable on Girls, Women, and Alcohol, an annual conference where we would make this subject a national priority. It's astonishing to me how easy it was to name it the National Roundtable on Girls, Women, and Alcohol because there was no initiative on the part of my country. This event was launched on International Women's Day, and David was there. It was a day of consciousness raising and priority planning, and a day of great success. Just recently, I was able to speak to the health minister in Canada and talk to her about marketing and hope that she was listening, hope that we're going to make some changes. My goal is to jumpstart national action in Canada, and I would advise that we try and do the same here in this country, because I'm not willing to wait to see if our government in Canada is going to endorse a national alcohol strategy. I'm not willing to wait to see if the province where I live is trying to move on a provincial alcohol strategy. I believe that communities should be producing alcohol report cards. I believe there should be a convergence of voices, because for too long we have known this evidence and we've been fuzzy on our values. Together, so much could be won. Thank you.
Thank you very much, Anne. We have time for some questions. It is being webcast, so we've got two people who will travel through the audience with the roving mics. And if and when you want to ask a question, just make sure you're speaking into the mic so that the people listening on the web can hear you. Do we have any questions? Yes, we have a question.
Thank you. Thank you especially. I appreciated how you talked about how we're very fuzzy on our values in this issue. Even at the School of Public Health, every time I attend an event like this, I feel very grateful that there are so many people who care about this issue, but every Friday we still have happy hour on campus. And alcohol is such a huge part of academia and being a part of a sophisticated circle. And since modeling is an important part of prevention, adult modeling, I think that it could start right here, and I'm wondering if you talk about that in your book.
I talk an awful lot about the initiatives that have happened on American campuses to try and, there's an initiative called NSHIP to try and raise awareness and change a drinking culture on campuses, and David could speak to that as well as what's happening in this state. One wise person, though, said, we have to change the entire culture. You can't just blame it on a campus culture and hope that the entire culture will change. We have to change North American culture, and in fact, I think we have to change global culture.
As a former communications director of mine used to say, I would turn back flips. If we could have a conversation here at the school about happy hour, it needs to be a student-driven conversation because it's the students' happy hour. But it is easily the most visible or one of the most visible social activities here at the school. And you're right, it's all about alcohol. And for a couple of years, we got on there a little PS that non-alcoholic beverages would be available. That's now disappeared again. So at a minimum, I don't know what we do, but I think having the conversation about it is very helpful. And then Anne's right, these conversations need to happen lots and lots of places. So one of the other things we've got here in Maryland is we've got a collaborative of 11 higher education institutions, of which Hopkins is one, where we're trying to reduce excessive drinking on college campuses from the philosophy that Anne talked about, where colleges are not in a bubble, that it needs to be engaging the entire environment around the school as well as what's happening on the campus itself. Thanks for the question. Do we have other questions? Yes?
Yes. I actually found it interesting that you said one of the things that kind of led you to consider going seeking help was the card from your son. So, and I just wanted to ask the question of both of you, actually, are there interventions that look at the impact of young people's perspective on their parents, especially whether as it relates to substance abuse?
The most common question that I get asked, beyond the one of why did you write this book, is I have someone in trouble. I get about 5 to 10 emails a day. I read your book. I have someone in trouble. I'm in trouble. What do I do? And never, ever underestimate the power of what a loved one can do. Never underestimate. It takes a lot to break through the denial when someone has a drinking problem. And interventions in whatever form they come, even if people are discouraged and think that their interventions are not noticed, they're noticed. And I, for the sake of time, didn't close with the ending, which is an assessment of my son 5 years later on how my life has changed. He asked me to draw up a loss and gains and insisted that I look at how long the gains list was. We were having a very interesting conversation last night, David and myself, and he had a very important point, which is it's not just the accidents, it's not just the missed opportunities of sleeping in, et cetera, the things that come with drinking, but the actual deferred dreams is how we put it. And we defer many dreams when we drink too much. And it doesn't have to just look like alcohol. It can be a person in first-year university who finds himself too often at the bar and finds himself switching into a major that is less than they might have aimed for. So I think we have to broaden our notion of what risky drinking does and what costs implied.
Other questions? I can't believe we've talked you into submission. Any other questions? Yes.
So as you were talking and thinking about how drinking has changed for women and how it's becoming more normalized to show up at an event with your girlfriends and everybody brings a bottle of wine at the end of the evening, all the bottles of wine are empty and that seems very normal. It doesn't seem like a big deal. What are the things that you would look for in someone who is progressing down that slope? I mean, you said it was very slow for you, and for someone who may have crossed that line, how are you to see something like that when all of the rest of the activity seems so normal?
Right. Thank you for asking that really important question, because mine was so slow, it was invisible, as I said, even to my best friend. Know that drinking behavior is sneaky. We do not, probably everyone in this room knows somebody who's drinking too much right now, but drinking is also sneaky, and drinkers are sneaky. And there are signs of a person who is late more often than they should be to work, who is not performing in a way that you expect them to perform or in a way that they have before. And I think as we tend to, there's a lot of research on how we tend to drink in groups. We tend to mimic the behavior of our friends. We sometimes shift friends. We shift friends to a lesser group of friends, or a group of friends that drinks more. And so if you notice a friend moving away from you into a new group that tends to party more, that's a very common behavior. But it can be seemingly invisible, but if you notice problems with someone that look invisible and don't have an explanation, you may find unexplained headaches, things like that. It isn't rocket science, but it is complex with women. Very, very hidden, often.
Other questions? Yeah.
Hey, so I was just curious what you think the impact of a predominantly abstinence approach to teen communications around alcohol has on their early formation and ideas around drinking and it being bad, or whatever you may believe is the thought process coming out of that communication.
Well, there's a really interesting thing, I think, with this parent group. In terms of Rob Teresi, a researcher, has done some really interesting research on the influence that parents can have, and that this parent population is interested in being friends with their kids. And they resist opportunities to actually have the conversation when they could be having the conversation. And one of the most important times to have that conversation about drinking is the last year of high school before people head off to university. He's produced a handbook that is actually a little more complicated than just reading it, but not rocket science in terms of helping people have that conversation before young people go off to school. I've met parent after parent who has said, I allowed them in my house to drink because I thought it was safer for them to drink in my house than elsewhere, even though they were underage. What do I do? How do I say no? There was actually a group of I don't know if you've read about it, parents of third grade students who allowed their sons and daughters to sip alcohol, thinking that if called a pro-sipping movement, if they sipped in third grade, they were less likely to drink too much when they were older. The experiment was a failure, obviously, or deemed useless, is a better way of putting it. So David might have something to add on the whole abstinence conversation, but my strongest opinion is have the conversation. If there's pushback, have it anyway. Even if you think you're not being listened to, you're being listened to.
I have a whole palm full. So I just need to go back to the research and what the research shows. The younger young people start drinking, the more likely they are to have problems with alcohol. Young people start drinking before age 15, 4 times more likely to become addicted. They're 5 times more likely to be in a motor vehicle after drinking, substantially more likely to experience interpersonal violence, etc. So a big prevention goal for us is delaying initiation. And the conversation we're in here, it's funny, we never talk about an abstinence-only approach in alcohol because the environment is so in the opposite direction around alcohol. The environment is it's not okay to abstain. And one of my prevention goals is that abstinence is always okay. That's where I'd really like us to get to. It's also really popular. I got to talk about Europe just because this brings into this whole area of teaching kids how to drink, of what's known as integrated drinking, the pro-sipping and all that. It's so tempting, and so I want to quote a British, Australian, Canadian colleague of mine who's now in Canada, who puts it this way: everyone wants to believe in a mythical land where children have brandy for breakfast and no one ever has a problem. And my friends, that land does not exist. If you look at the comparable surveys we have for the US and roughly 30 European countries, what 21 does in the US is it delays the initiation of drinking, which is really good for health of our young people. Of those 30-odd countries, we are number 2 lowest in terms of prevalence of drinking among 15 and 16-year-olds. That's the group that's surveyed. The only country lower than that is Iceland, which has a drinking age of 20. So that's what those drinking ages do. If young people start drinking in the US, they drink like the adults do here. They drink like, and we drink like the Germans, the British, and God help us all, the Scandinavians. We are a heavy drinking culture if people drink. So we want to delay initiation. But then we also want to keep in mind we're a public health school. And a lot of these questions around what do I do with an individual's problem, and I am deeply sympathetic to those questions. At the same time, my work, the center's work, is very much what's a public health approach to this? How can we reduce population level of risk, taking on the marketing, the pricing, the availability, as Anne referred to it. So the rest of my goals, one is abstinence okay. The second is no use, no heavy use. The third is no use in high-risk settings or high-risk populations. I have to put those goals out because the minute you start saying anything negative about alcohol, people assume you are all about abstinence and prohibition. We live still under the shadow of prohibition. And I am not a prohibitionist, I'm a public health guy. I go with what the public health research says, and the public health research says, you know, it'd really be good if we could delay drinking onset as long as possible. Yeah, Wendy.
Can you talk a little bit about what you recommend for like a campus message for kids if they're at a party, like, I mean, abstinence, but if they're not willing to do that, or is there other alternatives that you're proposing for having, I mean, what is your message for a campus right now on what you want them to make available or what you'd like them to do to have other alternatives?
Do you want to? I wish there were a single message or a single magic bullet. The approach we're promoting to the campus is multi-component, multi-level. That the messages at the various levels coming at kids from various places need to reflect each other. So when kids on the Hopkins campus go to Maxie's, you know, Maxie's is strictly enforcing 21. That would be like so special. When they go to the other local outlets, 21 is taken seriously. That would be really, really helpful as a message. And that's a much bigger message than a poster campaign. You know, beyond that, it is understanding, and, you know, we try to do this. Oh, I know what else. So the other message we have here, and this is the Institute of Medicine looked at this in 2002, 2003, and they concluded basically that we don't know what messages are going to work with kids, but we know the messages that are going to work with adults. And the key thing here is a broad societal commitment to reducing underage drinking. So that's where the bars come into play. That's where one of the other places we're working with campus is, what are the touch points where you could possibly identify a student who's got an alcohol problem? And a really underexplored one is academic assistance centers. It is a place where the drinking is going to show up. We've got the data now. One of the long-term surveys, it's so interesting. Kids with alcohol and drug problems, they trade down in their majors. They start out being interested in a STEM major, and over time, they move into easier majors. They're changing their life aspirations. That has all sorts of implications, and some of that will show up, again, in having trouble in those courses if we can put some simple screening in place in those settings as well as some of the others that we're looking at. So those are some of the things that we're trying, but it's going to be a bunch of things and no single. Yeah, we got one in the back.
This is a question for both of you, both with the research and within your book. And I was wondering if you looked at drinking behavior across different demographics of women, and for example, class or women who would never be drinking in a university setting.
What was the last part?
Yes, women who would never be drinking in a university setting. Yes, I have a broad range. There are roughly 40 women between the ages of 17 and 84 in my book, and cases of women who didn't go to high school, didn't obviously go to university, from different racial backgrounds, and there are different pressures. As it says in my book, and very much echoing what David said, there's no really good reason why anyone drinks before 12. Really, generally speaking, if someone's drinking at 9 or 10, they're drinking for reasons, especially if they're female, that are well documented in my book, but I document young men's reasons as well. And they're pretty predictable, and they really dovetail with the kind of thing that David's saying. If you looked at, a lot of people have been talking about screening in grade school. If you were able to look at the person who's having trouble in grade 4, who's drinking, grade 5, who's come from a very troubling family, is already exhibiting those kinds of behaviors. If you were to intervene, there's an unbelievable project done here in the States called the Runaway Project, which took a whole group of runaway young girls who were picked up with Johns, roughly 13 years old, and taken, instead of ending up in jail, or police didn't know what to do with these young girls, they took the young girls, they put them for a year in either foster homes or returned them to their families. They gave them incredible support, and an incredible number of them have succeeded. So it was a real experiment if you can turn a person's life around and reduce the harms and reduce the pressures. As I said in my talk, so often it's not what's wrong with that girl, but what happened to that girl. And it isn't rocket science what happens in terms of some people really falling between the cracks.
So I think the technical answer on the data side is we have tons of data on those questions. Just very quickly, and a couple of the surprising things maybe, the more money people have, the more they drink. This is not like some of the other health problems. The prevalence of binge drinking is highest in people who are earning $75,000 a year or more. When we bring that down to the youth, college students more likely than those not in college, and we've made more progress in reducing the drinking of those not in college than we have reducing those in college. But this gets back to, in terms of race, it's American Indians and Alaska Natives are top, and there's a specific reason for that that is historic and biological. 2 areas of the world that never had alcohol before colonialism, North America and Oceania. These are populations physically that did not develop means of metabolizing alcohol. There's a particular physiological vulnerability there. After that, it's whites, Hispanics, blacks, Asians. Black kids drink so much less than white kids. Some of that's the income effect, some of that may be religiosity effects, but substantially less. But what you hear about, the classic stories, are the poor person whose life's been ruined by alcohol. And this gets back to Anne's point and her story, which is that the high-functioning people's problems don't get seen, their stories don't get told. There's all sorts of ways that privilege works into that. It's easier to hide it in a certain way than if you're in a situation where you've got much less resource and frankly, much less pretense around of what things are actually like in your life and your family. Yeah.
So if you look in the literature, the epidemic that's getting more press now is prescription drug abuse. Do you want to say, I would say, right, in the popular press and elsewhere, do you want to talk a little bit about the intersection of that with the rise in alcohol use?
Sure. You want to talk about that?
You go ahead. I have something.
Well, I grin just because, yes, we're concerned about prescription drug abuse, but I've been in this field for 25 years, and I'm so used to the drug problem of the month. And alcohol is the drug problem of my lifetime. You know, alcohol continues to be so much more serious, and then alcohol in combination. You add prescription drugs on top of that, you add, rave drugs, etc., and you've just got a worse situation. Energy drinks, Red Bull and vodka. I mean, this is creating a population of wide-awake drunks. This is so not a good idea. And we're just starting to have the public health data to be able to have that conversation. So yes, we're concerned about prescriptive drugs, and yes, but the other thing to point out there, I guess, is that people assume that if there's more prescription drug use, there'll be less alcohol use. And in fact, what Monitoring the Future, the long-term survey of 8th, 10th, and 12th graders' drug use shows is that their drugs all have tended to move together. So that prescription drug use is probably additive rather than substitutive. You've still got the alcohol problem.
I see this so much, having been to quite a few treatment centers, is that I'm a classic plain vanilla person who got into trouble with alcohol, but if you hit 20s and people in their teens, 20s, or 30s at treatment centers, it's all polysubstance. And throw in an eating disorder as well, and some other problems. But prescription drugs, definitely part of the picture.
Alicia, hang on. You need the mic.
We have a question from Twitter for Anne, which is, can you talk about what you've seen with digital marketing and alcohol?
I'm so flattered that question came to me, but this is a David question because everything I learned about this came from David.
What we're seeing in digital marketing is that the alcohol companies are at the forefront of innovation in digital and social media. They're on Facebook's council of companies that get first access to tools that will drive greater user engagement. And then the other thing that we're seeing is very, very, very weak protections against young people being on the alcohol-branded Facebook sites, et cetera. We can't get the same kind of data for that we get from Nielsen about television because it all belongs to the companies. But kids are leaving their footprints. They're leaving photographic footprints. We know they're on there because it's so easy to see their pictures that they've left up on the company Facebook sites. Any other questions?
I just want to add something that I did learn from David, which I think is just brilliant, which is this is called pull marketing. In other words, it's the young person sitting down at their computer being pulled towards this advertising instead of a person, as I would be, sitting on my couch tuning out a commercial. That's a very different activity. That is a very engaged bit of activity.
Oh, and I'll do a little pitch on the Johns Hopkins YouTube channel. There are 3.5 to 4 minute videos that we did on digital and social marketing of alcohol. We got one more question, I think, and then.
I was curious if you could speak to the role of technology in preventing alcohol-related issues.
There's an enormous, I'd like to speak to the role of technology in aftercare and instead of prevention. There is an enormous development that I think is really, really progressive in using technology for aftercare. Typically what happens is you do your 30 days in rehab and you are drop-kicked out into the world to flourish. And we don't do that to cancer survivors. We give them enormous amount of care. And there's been a lot filmed and done about this subject. We just think you should go back to your life and figure out how to sort things out, and that is virtually impossible. Recovery is not for the faint of heart. All of a sudden, you're at a birthday party or you're at New Year's, and you have a certain way that you've coped for a long time, and you're not coping that way, and it's very, very difficult. I slipped quite a few times after rehab because I came here in the States and found nothing in the Canadian system that would help me. So technology is inspired in being used. It is inspired to use technology for aftercare, for follow-up, for reaching out, for reaching people in distant situations where they have no access to brief interventions, and this kind of human help.
So in terms of the pure prevention side, a couple of things. First, if the road to hell is paved with good intentions, the road in my field is incredibly well paved. We have tried so many different things, including using various forms of technology, social media, et cetera, messaging to kids, et cetera. These are such tiny drops in the bucket compared to what they're getting from the rest of the messages from society, which is why our focus is on trying to shift that message environment. The one area of technology that I think holds a lot of promise, it's not a new technology, but boy, it was amazing in tobacco, was counter-advertising. And there are virtually no experiments in counter-advertising, true counter-advertising for alcohol. There's one youth group in Dover, New Hampshire, who do great youth-developed counter-ads, and I play them all over the country and try to encourage people to emulate it. The larger point is young people face a completely imbalanced message environment, and that's what we're trying to address in as many ways as we can. We're about out of time. I'm just so pleased to have had Anne here, and please join me in thanking her.
Thank you.
And thank you, Professor Ganji, and thank you all for coming. It is our great pleasure and honor to be here at the Bloomberg School and be able to do the work we do. So thanks a lot.